Permanent Secretary, Lagos State Ministry of Health, Dr. Olusegun Agboye, to please give us some Ogboye. Yes, thank you, sir. Sorry for.
Good afternoon, everyone. Unfortunately, government people do a lot of protocol. Unfortunately, I don't have the protocol list, so I will stand on the existing protocol and just welcome everyone here to this wonderful event. I joined Doc when we went round now to look at the stands, and it's amazing the amount of work that's going on, especially with natural remedies. It's really, really impressive. And there was something for me there, which I was too ashamed to buy while we were going around, but which I will go back and look for. I don't know if some of you can guess what it was, but there was something there that I will pass by again. But like I said, I couldn't take it right then. I didn't want everyone else knowing what my real problem was. Oh no, not that one.
We're very anxious to move in straight to the second segment of this technical session. And it's going to be very, very exciting and electrifying. Just coming in is the retired Director of Food Safety and Applied Nutrition, Alhaji Sheriff Olagunjo, who is doing very well for himself. And thank you very much for coming and for your solidarity and support. So we're going straight, and the moderator for this technical session is not that person than the convener herself, and that's why I told you it's going to be very, very electrifying and very illuminating. Is Dr. Monica Eimunjeze. Ma, you're welcome. And the panelists is a panel that is star-studded. And we have on ground Dr. Mrs. Bolanle Deji-Okubanjo. Doctor, you're welcome, please. Then also on the panel is our own very dear Air Commodore David Babalola, surrounded and surrounded with the officers. Oga is safe. Thank you. You're welcome. Another member of the panel is Dr. Olajumoke M. Koejo. Dr. Koejo. Mrs. Lilian Arigbodi. You're welcome.
So good afternoon, everybody. So we're going to be talking about self-care as a driver for universal health coverage. But let me first of all introduce our very eminent panelists. We have Dr. Bolanle Deji-Okubanjo. She is a practicing clinician, a member of the Union of International Cancer Control in Geneva, a member of the Nigerian Essential Medicinal Plants Listing Board, a member of the European Society for Integrative Oncology, a member of the International Society for Ethnopharmacology in Germany, and also a member of the Medicinal Plants and Natural Products Research out in Germany. A very distinguished speaker and practitioner within the integrative oncology space. Join me to welcome Dr. Bolanle Deji-Okubanjo. Mrs. Lilian Arigbodi is the founder of Lilian Collins Limited, a qualified esthetician certified by the American Board of Estheticians. She holds various advanced certifications, including a Master of Science in Aesthetics. The founder of Lilian Collins Limited. Join me to welcome Lilian Arigbodi. We have Air Commodore Babalola. He's a pharmacist who started his career several decades ago in Glaxo Wellcome. He holds numerous certifications and postgraduate diplomas, including Masters of Science in Strategic Studies and postgraduate diplomas in international affairs. In 2022, he was the first pharmacist to attain the rank of Air Commodore in the Nigerian Air Force. a multiple award winner within the Nigerian Air Force of operational and strategic trainings within the armed forces. He has had the honor to present at several national and international fora and to be so recognized. He's also the first pharmacist in the Air Force who is a fellow of the West African Postgraduate College of Pharmacy and is presently based in the Doctrinal Air Warfare Center of the Nigerian Air Force in Abuja. So self-care, we have different perspectives around that topic. So I'd like to start by asking our panelists to tell us a little bit from their backgrounds and perspectives what they feel about self-care, the prospects and perspectives as we advance towards universal health coverage and the sustainable development goals. Let me start with Dr. Bolanle, please.
Thank you for giving me this time out, and let me stand on the existing protocol. Now, if we're talking about self-care, I want to leave WHO out of it. I want to see what our perspective is about self-care, which is the things that you do to yourself and for yourself to make you to stay out of the hospital. It's as simple as it is. The things that you do that will make you to stay out of the hospital, that would, it might be with the assistance of the medical personnel and it can be without their assistance. But those things that you will do that will make you to stay out of trouble, of having health issues, the things that are around you that you can use, that can make you to be healthy. In the first session, we had a lot of things, the water, we had the exercise. These are things that you do. We had about your diet, the things that you put in your mouth. And then much more than that, what about the herbs that are around you? And then another of the speakers this morning said something about a merry heart doing good like medicine. And this is a scripture that I actually find out because I wanted to know why. But we, as pharmacists, I know that a lot of you in the house, you know that when you're happy, you begin to release a neurotransmitter called dopamine. And what does that do? It gives you the happy hormone. It's called the happy hormone. And then it doesn't make you to break cortisol. So what are the things? So if you go to a dance class, you're actually working towards your health. When you stand up and do exercises, you're working towards your health. So the things all put together, the herbs you take to make you to attain stability, to help your system to come back to homeostasis, all these things put together is what gives you self-care. And if you're going to have self-care, when I saw the topic, I said they will have redefined self-care as selfishness of the being. Because if you're not selfish about it and intentional about yourself, especially for us, the women, you just find out that it's very triangular for you. My husband, my children, they go to school and I die. So you have to be very intentional about it. And that is what self-care is about. Thank you.
Thank you very much. Let me once again just appreciate this platform given to share my thoughts on this very important topic, and also appreciate the convener for this wonderful conference. Well, self-care, I like to go by the way of the WHO, and looking at a perspective of the WHO that talks about social determinants of health. And I was surprised when I saw that WHO stated that more than 55% of every health outcome is actually attributed to social determinants of health. And these are things that had no direct bearing on health itself. Things like housing, things like food security, things like exercise, even safety and security, loneliness, and a lot of other things like that. And for me, these social determinants are low-hanging fruits that every individual can do something about. It's something within our reach, something you can control, something you can determine. And if you're able to determine and control that, then it tells you that it ultimately impacts on healthcare. So for me, self-care primarily has to do with that awareness, that self-consciousness, that health literacy, to be able to know that there is impact of my sleeping on health. There is impact of diet on health. There is impact of exercise on health, and all those other things that we take for granted. And at the end of the day, we this part of the world, we are so into drugs. We believe there is a pill for every ill. And once there is an illness, just go and take a medication and that is it. But that is not actually it. A lot of all those things are rooted in those social determinants that we will take care of normally and, effortlessly, and our health will be top notch. Thank you.
Thank you very much, Lilian.
Good afternoon, everybody. Thank you so much. I'm different from everybody. I can see that a lot of us are in the medical area, especially the pharmacists. I'm coming from the aesthetic point of view. And to answer the question today, I would also like to ask a question to the audience. How many of us service our cars? How many of us? We all service our cars. And when you don't service it, what happens? You're supposed to service once every month, right? So when you don't service your car, you have problems. And those problems can run into millions, especially now that the economy is not that fair to all of us. Yet, we have a lot of us that have never gone to a spa before. We regard it as luxury, something people that have money, do. Self-care is being able to think of yourself first, being able to do that thing that is necessary for you to work, for you to be productive. Going to a spa is not luxury at all. You must, and I mean it must, just like you go for your BP, checking out your health status, your BP, your everything, you must have your regular massage at least once in a month. If you don't do that, then you're not taking care of yourself. It doesn't matter. There's so many different places you can get that. Some people are lower in prices, but again, make sure you're going to people that are educated and trained properly to know where to touch to give you that relaxation that you need. So going to a spa or a med spa is not a luxury. It is actually a necessity. Just the way you service your car, you need to take care of your body. Thank you.
Thank you very much. I'd like to pick up on something Lilian mentioned. When we talk about wellness and we talk about self-care, there's no one profession that has all the answers. Part of what we're trying to make people understand is everyone has a contribution. We have to be very holistic about the approach. So the more we have interactions across professional lines, across different areas of specialization, the greater we realize the impact. So like, for example, somebody that's in the entertainment industry has a contribution to make when you talk about wellness and self-care. Some people use music to relax. It's all part of it, and a lot of people are very happy and all those happy hormones when they listen to music. So there's also a space within that sphere. Whether we're talking about physical exercise, and actually using the gyms and eating right and nutrition. So let me ask Dr. Deji, what are some of the things that you, in your experience over the years, for those that maybe didn't catch what I said when I introduced Dr. Deji, she's an integrative oncologist. Many of us don't like to hear oncologists. That cancer is a sentence that we must not say. It's a word that we must not utter. But it is one of the non-communicable diseases, and it is very much with us. So can you shed some light on that area, please?
Thank you. If you're going to be, I'll be talking in my perspective as an oncologist. When you want to talk about self-care in oncology, then you're looking about the quality of life, your quality of life. And then how do you get that quality of life? Is by supporting your immune system, reducing the side effects of the conventional treatments like chemotherapy, radiation, immunology, and all that. And then promoting emotional well-being. You'd agree with me that if you're told that you have cancer, the first thing that happens is not that your immunity dies on the spot, but your emotional well-being will be touched. And coming from the angle of that, I'm a survivor. So it's not something about what you read, it's about what you passed through. like I said outside a while ago, I was a practicing chartered accountant. As a matter of fact, I was the chairman of Society of Women Accountants of Nigeria when tumor happened. And then I had to go back as a clinical herbalist, learn to become a clinical herbalist. And coming out of Herbal Academy, I came out without tumors, I came out without cancer. Why? That means that somebody's been able to support me. And then there are things that you can do, you know, to actually bring you out of cancer. And this is self-care in terms of cancer. I didn't want to miss them out, so I wrote a few points that the importance of integrative care in itself is a kind of self-care. You need to understand, you need to allow the people understand that yes, you have cancer. And yes, cancer is a killer, but it doesn't mean it's going to come and kill you. That's the first thing. You need to work on your own psyche. That, okay, yes, I have it, but it's not meant to kill me. And then, you know, oftentimes, pharmacists, clinical pharmacists, community pharmacists, you're angry when patients come in and they're like, I know my body. And you're like, I'm giving you antibiotics, and you say, I know my body. I'm the one that can tell you how my body has been feeling before the problem came. You are not in my body, so you cannot know my body. So allow them to be open to communication, because in cancer care, until somebody tells you how he actually feels, you don't know how they feel. So you cannot know their body. They are exposed to radiation, they are exposed to chemo. You wake up in the morning and your hair is falling off with you. That is traumatic for anybody. So they know how they feel. You know about your drugs. You don't know the trauma that is attached to somebody not having hair on their heads. So the number one thing is to allow them to believe that what they're passing through, even though emotional, is not meant to kill them. And that is the first thing in cancer care. If you cannot get a patient to believe in themselves that they're going to make cancer, I have to tell you the truth, you have lost that patient. 50% of the work is emotional. And so you have to enter that emotional space, which we call hypnotherapy. Because if you come to me now, I'll probably take you through counseling, hypnotherapy, and whatever it is you want to call it, to make you believe that cancer came and it can go. And that's why I'm also a living witness today. Encourage patients to inform their doctors about the herbs they take. I treat my cancer patient basically on herbs, but there are the herbs they should take and there are the herbs that they shouldn't also take, because we have things like herbs are natural, hence they don't kill. That's not true. And I know that the major thing about biology in Nigeria is that we'll say, no, Babalawo, they don't have dosage, but that's not true. We do have dosage, and you need to put your patients through that if you're going to talk about their self-care. Sorry, I'll handle. Now, you also have to allow them, expose them to immune modulators, which they are supposed to take in their house. So when people take things like mushroom, you open them to the use of things like beta-glucans. But beta-glucans, there is a misconception about it. They just tell us, put mushroom in your food, it's very healthy for you. The dietitian says that. The dietitian doesn't tell you that your beta-glucans is not extracted until it's on your stove for minimum of 2 hours at low heat. So somebody just puts beta-glucans, mushroom in their food and eats it, and it doesn't do anything to you. Now this morning we heard about drink water. A cancer patient needs to drink water. But at what quantity of water am I supposed to give to you? 3.174 times your weight over 100 is what you should be taking. Your weight before the cancer happened. That's what you should be taking. So, and that's why I like this, because we are coming from different angles. Me, I'm coming from the angle of biology as a clinical herbalist that I am. And you see, these things had been working for the patient. You need to allow them know that it's not just about drinking water. There is a measurement for the water intake that they must be taking. So that you also avoid overstimulation in their system. And then how do you manage side effect, the nausea, the digestive issues that they are going to have? They are not going to have those things in the hospital. when you give them chemo and they leave you and they get to their homes, when I finish taking it and I get to my home, I'm throwing up right from my staircase. My doctor is not there to pack the vomit. So if you're going to talk about cancer, then you should be looking at how is that patient going to manage himself or herself when he or she leaves the hospital, when she leaves the environment of the hospital. And then you're not talking about mild things like ginger, like peppermint, to provide them with relief and the quantity of these things that they should take, how it can suit their stomach, how can they approach fatigue, because you cannot be on chemo and be active. You're going to be fatigued. So what is that patient going to be doing when he or she is fatigued? While I was seated there, a patient called me from UK. She just finished cancer. She's collapsing in her house and she had called 911, but they are not there yet. So she said, but Dr. B, what do I do? I said, do you have carrots in your house? He said, I do. I said, can you crawl to your kitchen? She said, yes, I can. I said, put on your blender. Put 3 sticks of carrots in that blender with a cup of water. Blend and drink, and your system will calm down. That is self-care. That is self-care. But if the patient doesn't even know that carrots is enough to curb fatigue, that patient can collapse before the proper medical doctors, as you so call them, comes in. So medicine is not a one-way traffic thing. It's a tree with so many branches.
Thank you very much. Thank you. Awesome. Let's change gears a bit. Let's change gears, because it's all about different prospects and perspectives. So Babalola is a pharmacist. He's a high-ranking officer in the armed forces, and he has experience across different areas of practice. We all know that the military has a very high expectation of its officers and its rank and file. And we know that health is also positioned very, very critically within the armed forces. So, Air Commodore Babalola, based on your experience and exposure over the years, what would you say about self-care, universal health coverage from a military perspective?
Thank you very much. From the military perspective, one thing is very central to us, and that is the issue of fitness. Fitness. And if you have to be fit, one of those things that we'll do over time is regular medical checkup. So we have an instituted system where everyone will have what we call annual medical review that you do on your birthday annually. It's difficult to forget because it's on your birthday. Apart from that, there's usually an instruction that goes out listing your name and reminding you that you are due this month. So now with that, we also have it segmented in such a way that those that are above 40 have certain illnesses that have, that are focused on, like diabetes, pap smear, cancer, PSAs and the rest of them, and then for those that are much younger, there are others that are the focus. So this is one of those things that happen. Then secondly, when it comes to exercise, for us, exercise is not just about keeping fit. It's more of therapy. And if you find that, you realize that exercise does not just, it gives you one of the things it gives you is it improves your mood and the way you feel, So for us over time, you find out that even when you see some retired officers, they are still jogging. Because over time it has become, you are accustomed to it, it has become part and parcel of it, is regular. Now, one important thing with exercise is it's not just to do exercise, but to make it a regular occurrence. For instance, even me, I do my exercise, I take sometimes up to 9-12 kilometers every week. I'm not saying you should go my way because I didn't start today. But for me, that is regular. And if I don't go that way, I feel something is missing. So over time, you find out that this actually improves your healthcare. And WHO has already also said it. If you take your diet, your exercise, to avoid tobacco and avoid alcohol to a large extent, you take care of more than 80% of all non-communicable diseases. So for us in the armed forces, those that issue of exercise is very crucial, and because you do exercise, it also links to your diet. If you exercise, you'll find out that you also be conscious about what you eat, because you'll be seeing the result from your exercise, and you can be seeing the two go, hand in hand. So apart from all that, one of the other perspective is, if you look at it from the healthcare perspective, it's important. Self-care is important because we talk about adherence in pharmacy. And there is no way that you see a patient come to your facility, he takes medication, he goes home. Once he doesn't adhere to that medication, because he is not part of that management, becomes a problem. But the way you will encourage adherence is to institute and ensure that the clients understand their disease state, understand why they need to take their medication, and also understand some of the side effects that are likely to come and what they can do about it. That way they take control. That way they are part of the management, and then they could also help them, in ensuring that that therapeutic outcome that is desired is achieved at the end of the day. Thank you.
Awesome. Thank you very much. So let's shift gears again, right? Lilian has a different angle. She's an esthetician by training. I hope I'm getting the word. I got it. By training and by exposure and by virtue of what she does. So a lot of us do not sometimes see the connection between aesthetics, health, and your mental state. So can you expand a little bit on that from your perspective?
Yeah, I'm going to use as a study point the women. Being a bit younger, when I was younger, I didn't know how women in their 40s and 50s, they feel. I'm not a man, so I can't refer to how men feel. Because I'm a woman, that's why I'm using women as a study point on what I'm going to say. So as a lady that is in her 50s, I'm young in my heart. I feel like I'm 30. I don't feel 50, right? But somehow my body is telling me you're not 30. Yes, your body is telling you, you're waking up every day, this one is shifting that way, that one is shifting that way, and you're wondering, but I don't feel this way, I still feel young. So that's where there is the aesthetics. The aesthetics will make sure that your body responds to the way you're feeling in your heart. You don't need to be ashamed that I'm doing this, I'm doing that. I mean, if you go for consultation, right people that are licensed to do that, they will tell you the path to take. You need a little bit of maybe filling up something there, a filler, a Botox, just to make you look, when you look at the mirror, it corresponds with what is in your heart. You do that, but you don't overdo it, so that you don't even, because those things also can make you look old if you overdo them, especially for the young ones that are entering into those sort of things and doing it now. I believe they should wait a bit, let them get a bit older before they start venturing into those things. And also, sometimes you see that you have things like, there's a bit of sagging on your cheek, the eye is gaunted, you have dark circles. The aesthetics have remedy for all of that. And we have people that have facilities to take care of all of that. So you don't really need to feel bad that you look this way or you look that way. We can help to help you mentally accept aging gracefully. Because some people, you will never know, some people, because of the way they look match with the way they feel, they enter into depression. I know some people that are like that, because they can't realize, they don't understand when they got to the place where they are, So it's hard for them then, unfortunately, sorry guys, you have a husband that doesn't care, he feels that younger women are better. You finally enter into depression. And we're telling you the aesthetic will make sure they balance things to make sure that you are confident in yourself and able to go through, these life changes without feeling that, look, why am I this way? Thank you very much.
Thank you very much. Wow. So I'm going to just very, very quickly give everybody about 30 seconds to say something before I throw it open. So we'll have a little bit of interaction. So, Dr. Bolanle, what would be final words from you as we wrap up this session?
Thank you. My final word is this. Everybody needs self-care. Whether you find yourself having cancer or you're going through menopause, as she said, or you're going through andropause, as she insinuated. Andropause is what men go through, is their own menopause. And then for andropause. So whether you're going through menopause or andropause, and then, men, they think they don't go through andropause. When you start looking for your key that you kept in your pocket, you're going through andropause. When you start getting touchy because a drop of water fell by the fridge and your wife was blind enough not to see it, you're going through andropause. So if you are men 45 and above, you might be going through andropause. If you're suddenly getting burned, you might be going through andropause. So whether you go through andropause or menopause for the women, or you're going through diabetics or high blood pressure, some of it which could be due to aging, you need self-care. Self-care is the ultimate that people need. Whether you just finished a surgery, you need self-care. Because I know herbs that if your surgery site is not healing, will tell you take. Unfortunately, lately I had somebody that was going for surgery and somebody told her, just start drinking ginger. Oh yeah, just start. And these are blood thinners. She almost bled to death on the table. So it is about information, and information. Read from the people that know. Tell them, ask questions. Ask people questions. I want to take this. Should I? What is going to be the effect? Keep asking questions. The Yoruba people say that the people who ask questions, they don't miss their part. Thank you.
Thank you very much. And I think if we must achieve universal health coverage, we have to do with access to quality healthcare services across all range of healthcare services in such a manner that it's affordable. Then we need self-care. And what will self-care do? Because when you look at the situation in our country, for instance, access to healthcare is still a challenge. Affordability is still a problem. And that tells you that if we must achieve universal healthcare, then we cannot rely 100% on the conventional healthcare sector. People must take responsibility for their own health. People must do a lot more to keep healthy, to maintain their health status, and to cope with illnesses. And that is where I will also still go that route of health literacy and information. Very, very important. And I think we need to be more aware. And medical personnel, for instance, are even a lot guilty about this. We attend to a lot of people, but find out how many healthcare pharmacists, for instance, have checked their blood pressure in the last 1 month, have done, PSA, or have even checked their sugar level, but we are busy telling patients to do so. So I think there's a need for that consciousness and that awareness and that education, and then not just to be aware, but to take action and do something. Thank you.
I would like to continue from where they started, from education. Because of the nature of the industry that I work in, I don't know what to refer it to as, but it's a marketplace. Everybody comes to play, so people don't take us serious. When somebody wants to get a massage, they will just call that girl by the come and do massage. Well, as much as you're taking care of yourself, that self-care that you engage with somebody that is not trained or have the capability to do it can also land you into trouble. I know somebody that have done a massage before and they had, do they call it a whiplash on the neck? Yeah, so that landed the person, he wanted to have a cheap massage, and then that landed the person in the hospital. He had to wear the collar. So as much as it's fun to have your massages, your facial, your Botoxes, your whatever, please and please make sure that you make inquiry where you're going to, that the person has license to practice. And they know what they're doing. Just like my sister has said there, they told somebody to take ginger. Ginger is a blood thinner, and you're using it before a surgery. That doesn't make sense. And that's what they come on social media to tell us. I remember once upon a time, my daughter that was in England in school, she said, "Mommy, I heard that, what's the name? Turmeric can take care of hyperpigmentation." I told her, I said, "Don't do that, leave it. It's not, you don't know the total, everything about it, don't do it." But she didn't listen to me. She thinks she knows more than me. She went and used that turmeric, and she had the burns. So it's not everything flying. Like the guy that is working with you on the social media, he says, "Sorry, we're not speaking. The people that know what is out there, we're not speaking." But there's still people talking. There are people talking. Unfortunately for us, for my industry, it's terrible. The quacks are doing more than the real people. If I call the name of my brand, you won't even know it. Lilian Collins Estate, you won't know it. But on the social media, people, I am the president of the Spa Awareness Association of Africa. I'm a member of the board of trustee of the local post ban. You know, we have all of that. But a lot of spas belong to that association. You will never see them on social media, but people are talking for us. People are talking for us and saying that. Sometimes I look at some things they show on YouTube, and I'm like, God, you know, and people, these people, they have money, so they push it out there like the real thing. So we need to be very inquisitive and intentional when we're searching for. Don't just go for anywhere because the place looks fancy, it looks nice, the person is on social media. Please don't do that. You know, thank you very much.
Thank you very, very much. And you know, taking up from where Lilian is, you know, that's one of the reasons why we have the DBio Wellness and Self-Care, so that those that are authorities within their space can have a voice and come out to give the right information. So I'm going to throw it open to the audience. 1, 2, 3, 4. It's only, okay, 1, 2, 3, 4. Okay, can we have...
Good afternoon, everyone. Good afternoon, Ekomodo and the team there. I'm a pharmacist, but I have a bias for the environment, and I practice more of mental issues these days. I've migrated a bit. Why did I have to migrate? If we look at all the things we treat around, most times, especially the communicable diseases, they have a very close link with the environment. True or false? True or false? So self-care we're talking about here, it's not only about your person. It's not only about your person. It's about the environment you live in. You see people very neatly dressed, but go to where they are. So there are things in our homes that we pay very little attention to, but they cause us harm. Our curtains, how often do we wash it? Dust is on it. Our sofa, the chairs, especially those that are closed, how often do we clean it? And then we see allergies coming up, and you get some treatment and you go back home and the allergy is coming and is going and is coming and is going. So we are trying to have a total approach to self-care. So environmental health is also very important in self-care. Your environment also defines your health status. So I want us to also pay attention to the environment we live in. Trying to wash your curtains. Some children are even allergic to the rugs, and parents will know. And the child keeps having constant nasal infections or respiratory distresses, and you will be wondering why. You think the doctor who is treating you is not doing well. But then the problem is from the home. So we need to understand our environment, and we need to take care of our environment, and our self-care will be more complete. Thank you very much.
I want to appreciate what everybody at this end has said. But what I've been able to have today is self-love, and first love is self-care. So be able to, in fact, establish that today, and I'm happy with this inaugural series. Now, the question I have is for the Air Commodore. We want to appreciate you and every member of the armed forces. The first session, they talk more about having enough sleep. All our gallant officers at the battlefield, how do you ensure they have enough? I mean, the minimum people have been saying is 6, 7. How do you ensure that the gallant officers that are protecting us, the integrity of the entire nation? Because my dear mom just said, the self-care has to go beyond us. We have to care for others too. So how do you ensure that, sir? Thank you.
Thank you very much for the wonderful session. My name is Afsa Aminikwe. I'm a clinical pharmacist, and I'm also a health and fitness coach. So I just want to add my voice, especially when we're talking about leveraging on technology. So I want to say that these days, everything is about being smart. Smartphone, smartwatch, smart TV. So, and I know a few of us have smartwatches. So how do we use our smartwatch? We're talking about drinking water, we're talking about not being sedentary. Do we know that we can actually set our smartwatches to remind us to take water? It can remind you after like an hour of inactivity to stand up. Sedentary alerts. Drink water alerts. So many alerts. So let's make use of this technology as well. That's what I want to add. Thank you.
Thank you. Good afternoon, everybody, and thank you for this very informative session. My name is Nsima. I work with Lagos Business School, Food Science and Technologies by training, moved into marketing. So first is the comment. If we are honest with ourselves, many of us have heard many of the things here before. And mine is just a reflection and question to the audience, to the panelists. How do we actually move from hearers of this word to doers? You know, if you're honest and you talk about nutrition, we know what we should not eat. Most of us, at least in this room. We know we should have 6 hours of sleep or 9 hours. We know we should exercise. We know we should drink water and choose water over carbonated drinks most of the time, especially if you're above a certain age. Is there any practical tip on how we can actually move from here? This is not just a talk shop, but we can actually do something. And I know one thing that works is the partner. You know, you can wear the Fitbits and everything, but sometimes just having a friend that says, let's go on a walk. You know, you can tell yourself an excuse. I'll not walk today. Ecuador does 12 kilometers a week. You can say, tomorrow is another day. But if I know that my sister Monica is going to tell me, Nsima, get up, let's go, it makes a difference. If I know that I'm going to be accountable to someone or a group, once upon a time, I belonged to a group, a fitness group, and we're made to report what you eat. And there were consequences. So if you ate what you were not supposed to eat at the time you were not supposed to eat it, you were supposed to do a certain exercise and record it. And it kept me in check. So I think for us, one takeout would be, what will I do differently after these 2 days of knowing about self-care? Thank you.
Well, I think for us in the armed forces, it's all about sacrifice. And that's why it's service to the fatherland. And right from the beginning, it is about some people that will sacrifice to keep their eyes open while others sleep. That's just the bottom line right from the beginning. And that's why emphasis is so much on age and youthfulness and fitness. But even with that, one of the crucial benefits of sleep is rest and, you know, for you to relax. There are other ways also that we try to relax, even though it may not be 6 or 9 hours sleep. Let me just stop at that. Thank you.
I want to add to what Sister Ntse said. For me, you said, how do we get these things done? How do we go from here and we start doing those things? I treat cancer. What I do is I look for the worst of the morbid cases. And so when I take you in and I know that you're not going to cooperate, I take you there. I force you to volunteer to clean up a patient. I tell you to God, when you leave that ward, you are going to do everything you are asked to do. Because when you see real morbid cases, you look at yourself and say, God, you are God. And then when you come out of that place, you say, I am not going to be found there. So you see, there's some patients that are just impossible. And so that's why I said hypnotherapy. That's a form of hypnotherapy, seeing what will happen in your future. That's what hypnotherapy does to you. This is what's going to happen to you in your future if you don't start taking these steps now. So if you think you are one of those people who think being a pharmacist or being a clinical herbalist or whatever will not make you know all the things. We all know all the rules now, but you don't want to keep them. Go and volunteer. Go to, I don't know the worst of the hospitals that you have here, but go to where you know you have morbid cases. If you are in Abuja, I will take you to National Hospital, Cancer Ward, and then volunteer to work there for just 2 weeks. We don't do volunteer work for whatever reason that is best known to us here. Volunteer for 2 weeks work as a clinical pharmacist, and don't dispense drugs. Clean the patients. Then when you come and tell me whether you will take water, you will jog, you will sleep, you will take your herbs or not. Thank you.
I'm so glad that I've been opportuned to speak at this very important summit. I want to congratulate you, our convener. This summit is very, very apt. For someone like me that is coming from the primary care, we are into promoting health and preventing diseases. So this is particularly exciting for me. I can also share with the House that recently the federal government of Nigeria has brought up a guideline on self-care. And the Lagos state government has also domesticated that guideline when it comes to reproductive health and maternal health. So with a guideline, self-care for this area is regulated. I've heard so many people talk today. What I see that is lacking is regulation. We're going to leave this place. There has to be some form of communique about these different areas. How do we bring up? And that guideline is something that speaks to the private sector and the sector, the one on reproductive and maternal child health that Lagos State has domesticated. So I would like to recommend that this summit, we might not be able to start with all the areas, but pick 1, 2, 3. How do we want to have a handshake between the public and the private sector and bring up guidelines on managing?
Awesome. Awesome. So let me add to what our director has said. The current advisor to the president on health, Dr. Salma Anas, she authored part of that guideline that you're referring to. And she's well aware, she has an invitation to be here. But unfortunately, she's at UN General Assembly in New York. So she did extend her apologies, but we are in that space. And she did tell me that she was looking to advance those guidelines to move into other areas and set up a task force. But that's just to give you that background. So yes, the first one coming out nationally, like you said, is the one that speaks to reproductive health. But there's so many areas. Non-communicable is one that really, really touches on all of us. It affects all of us. So maybe that would be a good place to start. And when you look at that, you know, there is a little bit going on in the space globally. When you look, like I put up this roll-up. If you look at that, the code at the bottom speaks to the International Self-Care Foundation. Now, they advance the 7 pillars of self-care, and it from something as simplistic as physical exercise to nutrition to mental health to rational use of products and services. So there's something for us to lean on. The WHO has some work out there, you know, where we can take some learnings, and FIP International Pharmaceutical Federation also has a little bit of work. So yes, there is need for us to drive policy and understanding around that. But in driving that, we need to make sure that we step up the literacy. Many of us are illiterate when it comes to health. And that's part of the reason why we start this discussion. This is an inaugural summit. We're talking to stakeholders. The vision is that moving forward, we will be now talking to the generality of the public, but at least we have stakeholders on board who understand the vision of where we're going, and DBio will be looking at that. We're also going to have communities around different therapeutic areas, to look to encourage that body kind of thing, to encourage people to do the right thing. Because yes, many of us already know, for our age group, when we go out and you see people still drinking carbonated drinks, I shudder, with all due respect, because you're overloading the system with. Personally, it's like once in a long while, which is okay, you can be moderate in what you do, but as we age, some people need to guess some of our ages, and the young ones coming up, this generation needs to be more conscious of it ahead, rather than waiting till you are at the point where the complications have already set in, which is what this generation is now seeing. We're dealing with the complications. We want a generation coming up that is already aware. So in your 20s, in your 30s, already doing those things that are making it less likely for you to develop the complications that your parents are dealing with, or the complications that our parents are dealing with, so that at the end of the day, you see the life expectancy. Why should the life expectancy for Nigeria be 54? Why should the life expectancy be 54 or 55? So if you're a day over that, you're in overtime, right? And I'm like, but even embracing this, so when I speak, our generation understand it a bit more, and the younger generation need to understand it even more, because 15, 20 years of doing the wrong thing, you'll be on dialysis when you're supposed to be enjoying that so-called money that you need, and the money will go in a heartbeat. But a lot of people are, illiterate about health. So you go out, they call it enjoyment, you're up all hours of the day and night, you don't have a routine for exercise, you're not mindful. I always say it, the Nigerian diet is a killer, loaded with carbs. 80% of your plate is carbohydrate. Nutrition content, there are people that know more about that than me. I think last week I was talking to them at Stanbic IBTC, and I said, I don't understand this love of rice. Suddenly, if there's no rice in Nigeria, nobody will survive again in Nigeria. It's at every corner. I'm like, what is it about rice? Used to be where Nigerians ate rice once a year. Now, if you don't eat rice morning, afternoon, evening, something has happened. We have moved from rice is 12,000 naira a bag to 88,000, and everybody's keeping quiet. But the rice we even eat is the worst kind of rice. The polished rice, when you go to Thailand, they will tell you they make it specially for Nigeria. They polish that rice white. I'm talking about what I know. I've been to Thailand, and they will tell you this is made specially for the Nigerian palate. What is wrong with the Ofada rice that you have, or the local Abakaliki rice or the local rice that we do in our? But you want that polished, refined rice, and now people eat it morning, afternoon, evening, because even Gari now I think is almost more expensive than rice. We have a problem in this country. So when you tell people that simple things like nutrition, eat vegetables, eat that ugu, that water leaf. It's cheaper. When we talk about fruits now, the price is another story. But if you are in your 20s, you're in your 30s, and you're very conscious about your diet, there are many things that you put at bay. So by the time you're 55 or 60, there are some things you might not deal with. So those are all the things that, are driving this self-care agenda. You have to be deliberate and conscious. If I ask here, how many people have done your annual checks? Your annual checks for 2024. Raise your hand. 1, 2, 3, 4, 5, 6, 7, 8. And you, the military boys, we know your own is first, you must do. It's still a very low percentage. Because what Nigerians say, what I don't know cannot kill me. Something must die, or somebody must die, or something. Something must kill a man or a woman. And so, you don't know, you don't check, it advances. So you pick a cancer at stage 4 as against a cancer at stage 1. It's a big difference. It's a very big difference. If we do random blood pressure checks here, we'll be astounded at what we see. Because even the situation, the environment within which we are with is very stressful. So how do you de-stress? Somebody was asking me, oh, the stress of this. I said, yes, like on Sunday, I did virtually nothing. I said, what will happen, will happen. What will be, and my head rests. So we need to be very intentional and deliberate about a lot of the things that we do. We have a generation that is upcoming that does not even live the way we live, which is going to bring up a different set of problems. The technology age is going to bring up a different set of, they're 24/7 looking at those screens. 24/7 looking at those screens. They are sitting there looking at those screens. The illnesses they will deal with at that time might be different from what, that macular degeneration that we are seeing. Maybe it will be a bit earlier, it's not a prophecy. So you need to be very conscious, deliberate, and intentional about some of these things. And those are part of the reasons why we're doing this. So we raise the consciousness and we continue the discussions and we move from talking to actions. Actions that will show results, actions that will drive us closer to having a healthier community, to have people that are living longer, to actually reap the rewards of what you are working for. You reach retirement age, as soon as you retire, a couple of years later, you are gone. People don't even enjoy what they've worked on for years. It's very sad. We've seen them. So let me appreciate this panel. It's just the beginning of a lot more interactions, a lot more discussions, and we really, really want to appreciate everybody who has joined in this session. You want to say something? Yes.
I just wanted to add to her, a lot is happening at the background. Like in our industry, the beauty industry, Sun came up, Standard of Nigeria, and they appointed some members, very qualified members of our industry to become technical committee. I'm part of that technical committee. So we're trying to build a guideline for our industry. So a lot is happening.
Thank you very much. So can we appreciate this panel?
It's been a great day. Tomorrow is another exciting day for us to wrap up. Thank you, and God bless all of you. Thank you.